Hello, everyone. We're delighted you joined today's Peace Talks webinar on the theme Governance Challenges in the Era of the Coronavirus. Thank you for making the time to be with us for today's important program, featuring 4 distinguished panelists: His Excellency Goodluck Jonathan, former Prime Minister of Nigeria; His Excellency the Right Honorable Stephen Harper, former Prime Minister of Canada; Honorable Sang Hyung-yoon, member of South Korea's National Assembly; and Dr. Intisar Azus, advisor to the President on Women's Affairs in Liberia.
Libya.
In Libya, excuse me. Okay. Each speaker will have 6 minutes to address the overall topic. Once the speakers have made their statements, we'll introduce questions from the audience. Please remember to submit your questions by email to peacetalks@upf.org. Include your name and position. Today's webinar is being recorded. The link will be available on our webpage at upf.org/peacetalks and on UPF's Facebook account later today. To introduce today's program and to moderate the panelists, I call upon Dr. Thomas Walsh, Chairman of UPF International. Dr. Walsh?
Thank you, Jeannie. Good morning, everyone from New York. We have a wonderful program set up for today. We're dealing with the issue of challenges facing governance in the era of the coronavirus. So, of course, there are many stakeholders involved and drawn into this crisis: healthcare workers, essential workers who keep the supply lanes open for food and water and basic necessities. Our focus today, however, is more on the role of governments, who have a special responsibility to address issues of the security and well-being of citizens. As we see 24/7 on the news cycle, the governments are being evaluated. Some are getting high marks and some are not getting all straight A's. And there are a number of criteria by which governments are evaluated: their preparedness, how much emphasis was given to preparedness for pandemics, issues of responsiveness, how quickly did governments respond to the crisis, who knew what and when did they act. Another area has to do with transparency and being forthcoming about data accurately. This has also been an issue. Of course, that's related to testing, but then on the foundation of testing, the accuracy of testing. There's also a lot of discussion about the impact economically, a global recession that is disastrous. Some ask, is the cure, namely social distancing and lockdown, is the cure worse than the disease? In this country, you hear discussions about deaths from despair, that there are unintended consequences of policies where there's higher rates of drug abuse and alcoholism, mental health issues. So governments are being looked at. They're also being noted when we identify best practices. We hear about South Korea in particular. We hear good news from Sweden. So we have a great set of panelists here, very distinguished. They will each speak from their own area of expertise and experience. And without further ado, I'd like to invite His Excellency Goodluck Jonathan, the former Prime Minister of Nigeria, Africa's most populous nation, and he is the chairman of UPF's International Summit Council for Peace, Africa. Excellency, You have the floor.
Thank you so much, Dr. Thomas. First, let me commend UPF for this initiative to join these discussions on the COVID-19 epidemic that is really worrying everybody in the globe. You asked me to address Africa. Of course, the approach by all the governments, like other nations, is the same. The issue of social distancing to control it, the issue of isolation and complete quarantine in case of people that have been tested positive. So we are doing that. All the countries are doing the same thing. But the key challenges, by my thinking, that the African countries have, I can see that even in Nigeria, we have a issue of testing, because the nations don't have enough of the test kits. And of course, most countries can't produce the test kits within the country, so we depend on external suppliers. And with the lockdown of the world, even to import or get this equipment is difficult. It's only the World Health Organization that can help African countries. Because yes, we're doing the lockdown, we are doing the isolation, but if there's no effective testing, then you lock down a population, and within that population, people will continue to spread. Because when you lock down a city or a state, people have to control, that security enforcement agencies will have to control the movement of the people. And the officers that are involved will also help. But in some cases, some of these officers happen to be carriers. They may be asthmatic, but they are carriers. So they themselves can even distribute, spread the virus. So the key, what we need for the world to help is to send more tests and the equipment to African countries. That will help us so much. Some countries like Ghana, they are even easing out because presently they have less than 1% mortality rate, and the rate of spread of the disease dropped significantly. So they have even reduced the restrictions. In a country like Nigeria, South Africa is still high, and the restrictions are still there. But restrictions without very, very strong testing, aggressive testing, not help the countries that much. We also have challenges in terms of distributing to lockdown cities, because some of the areas where people live is not so easy to access. It is easier in the smaller communities because there's clear identity of the people, you give to the community leaders, and the relief materials will get to everybody. But in the cities, especially in the high density areas, where people stay in crowded circumstances and environment, distributing these items becomes a major problem. That's one of the problems facing most of the African countries. And one other thing, nationally thing, that is responsible for the passiveness of the lockdown is that national government may be doing well, but how effective are the states or the provincial government or the regional government? And how effective is the city government headed by the mayors or the local governments headed by local government authorities? In some African countries, the central governments are doing well, but it does not trickle down, because for us to contain the COVID-19 pandemic, that means that the national government must work in concert and in the same direction, regional, provincial government or state governments, and they must work in concert with local governments and the city governments headed by. But in some of the African countries, this synergy is not there. The question expected at these three levels of government is not there, and that is a basic limiting factor. I wouldn't want to bore our listeners with the history of viral diseases, but Africa, we've faced similar viral diseases before, so it has given us some experience. You remember 2014, we just battled Ebola, which of course I was the president in Nigeria then when we had the Ebola incident. We've been experiencing the SARS before, the severe acute respiratory syndrome. Of course, we have been experiencing the Lassa fever. These are all viral diseases that sometimes the behavior is similar. So we have an idea, but their limitation is in terms of having the required equipment. Even the PPE is the personal protective equipment. And people are improvising face masks, which some of them may not be good enough. So the properly recommended medical face masks, well, of course, one may say it's only medical practitioners that may use that very comprehensive one, but the people who are into managing this pandemic that move from one place to the other too need this. And also we have short supplies, people are improvising, but I believe improvised ones may not have the good quality material, and probably some people may even be exposed to more danger than even not wearing the face mask. But that is what they have, so they have to make do with what they have. The issue of personal hygiene, like washing of hands and using of alcohol-based sanitizers, been practiced. The only thing is that one is not too sure across Africa in terms of the quality of the sanitizers, because they're supposed to have a minimum of 5% alcohol. But are we sure that all the sanitizers given to people have that level of alcohol? And of course, you know, business people, some of them are not too patriotic. They exploit the situation to make money and may not even add enough alcohol, and people will buy it thinking that they are safe. But actually, they are just moving with bare hands. So I wish you there will be no time for somebody to go and begin to even examine all the sanitizers that are being used, because the whole country has been shut down and it's an emergency situation. No country can adequately prepare for epidemics and pandemics, because it comes up at a time you don't even prepare. But so far, looking at the limitations we have in terms of the capacity to manufacture this equipment that are required, and of course the economy too, the African countries are trying and they are doing well. Some countries are doing a little better than others, but for now it's only 2 African countries, I think Comoros and Lesotho, so that we don't have the COVID-19 incident, but almost all the other African countries have, though at different proportions. But the countries are working hard and will continue to work hard, but we plead that the World Health Organization need to come to the aid of African countries, especially providing these test kits, so that when the cities are locked down, when the states or regions are locked down, we will be able to do aggressive testing, so that we'll be able to isolate people that have the disease from people that don't have. In that case, within a reasonable number of days, in 2 weeks or so, you'll be able to sort out the problem. Otherwise, you continue to lock down the city and the incidents will continue, and you may do that for months and it will not work if there's no aggressive testing. I thank you so much, and I will come back again when specific questions are raised. Thank you.
Well, thank you very much, Your Excellency, President Dr. Goodluck Jonathan, former president of Nigeria. We're very grateful. I'd now like to invite the Right Honorable Stephen Harper, former Prime Minister of Canada.
Thank you very much, Dr. Walsh. And I also would like to begin by congratulating yourself, Dr. Moon, and the Universal Peace Federation for holding this dialogue. I think obviously it's extremely useful for everybody at a time like this, and I'm honored to be invited. My background is that I was Prime Minister of Canada during the global financial crisis of 2008-2009. So I see some of this through that lens. I like to point out, by the way, I was one of the few democratically elected leaders to politically survive that period. So I think there was a sense that our response was relatively successful. But if anything, that experience has made me less judgmental in this case. I know how difficult it was in 2008, 2009. Governments are, as we say, drinking from a fire hose. But this situation is far bigger and far more complex than what we experienced in that period. we have a dual crisis, obviously a health crisis, the pandemic, and we also have a global recession developing, a global recession which, from what I can see, is going to be of much greater magnitude than we experienced in 2008, 2009. So governments are really struggling everywhere. And when you read, as we do often these days, and Dr. Walsh, you made reference to this, that some are doing it right and some are getting it wrong. The truth of the matter is nobody knows who's getting it right and getting it wrong. This is a unique and unprecedented situation, and we simply don't know how to respond correctly. It's where governments are feeling their way. And quite frankly, we are way too early in this crisis to assess ultimate performance. We're a long way from knowing what the eventual death rates will be. We're a long way from knowing what the full impacts on the economy will be and the duration of those impacts. Although I will suggest to you that they're likely, I think, much greater than people believe. It may be that in some cases, some measures are working better than others. I think we can say with some degree of certainty that there are a small number of countries, mainly in East Asia, who have contained the virus quite effectively. I think of South Korea and I think of Taiwan in particular. And what has happened in those countries? Obviously, some experience in dealing with pandemics, a very early response, but also an ability that frankly most countries lack, an ability to lock people down in a way they will cooperate with, and then track and trace the illness, which, as I say, is a capacity that simply doesn't exist in most other places. But as I say, we should be humble about, as I say, what's working and what isn't. We may well find, if you look at the virus and its spread and the eventual statistics, we may well find that government measures were rather indifferent. For example, we may find that, I think there's already some evidence, if you look at the data, that population density may be a big factor. Governments have no control over that. We may find that weather and temperature is a big factor. All viruses have a preferred temperature range as living organisms. And as I say, we may also find that there are social issues, talking about East Asia, there are social issues such as the public's willingness to submit to social controls quite voluntarily, independent of governance. We may find, you compare Taiwan and China. Taiwan, democratic country, China obviously extremely authoritarian, but both will follow social control measures regardless of the governance of the country. So we may find that governance is not as important as we all believe it is. But I say we're in the early days. I'm just speculating. Obviously, early lockdowns, tracking and tracing make some difference. I don't think there's any doubt about that. My greater concern, I suppose, partly from my experience and my knowledge as an economist, is the economy. I do think, as I said earlier, many people are underestimating how big the recession is going to be, how people's livelihoods are going to be affected. I think they are overestimating the capacity of governments for any sustained period of time to continue to provide the kind of fiscal supports they're providing. I think they're probably, in a lot of cases, overestimating the degree to which there will be an economic bounce back. I think that really varies by country. I can see that happening in the United States quicker than a lot of other places. I would say every week past the first month, you take an economy beyond a shutdown, you do long-term damage. Economies are not like cars. You can't turn the engine on and turn the engine off. And, if you look in particular at something like the energy markets, the damage there is quite significant. It's going to have spillover effects in all kinds of jurisdictions. So, as I say, I think we can talk about these things and observe things, but I think it's really premature to make a lot of judgments. The one observation maybe I'll end with, one observation I think we can make with some degree of certainty as this. What I remember about 2008, 2009, the global financial crisis, was that very early on, President Bush assembled all G20 leaders. It was the first time we got together, all G20 leaders and international financial agency heads. And we got together at the White House in early 2009. And we developed a coordinated framework for responding to the financial crisis. Now, look, individual countries had to go off and work on their national plans, and there was lots of differentiation. But there was a high degree of international cooperation, coordination, and dialogue throughout. And it was helpful, and not just helpful in terms of response, but helpful in particular in avoiding what I would call systematically damaging actions. What has struck me about this conference has been the relative lack of global leadership, coordination, et cetera. We can argue who's at fault and who isn't, but I just think that's been a reality. And so we have seen things that were, I think, unimaginable in 2008, 2009. Canada and the United States fighting over personal protective equipment. You know, really, these kinds of things should not happen. And obviously, what I mentioned earlier, in the middle of this, we have a damaging oil war between the Russians and the Saudis that spins out of control and damages everybody. So, you know, I say that governments deserve to be cut a lot of slack for feeling their way through the crisis. We should withhold judgment to date on who's really getting it right or wrong. I do think that we could say without a doubt that the lack of international cooperation, coordination has been a problem. And let's hope that whatever one's views of the WHO or other entities, that for future such pandemics that we kind of have, as a globe, we have our house in more order than we've had this time. Thanks.
Well, thank you, Mr. Prime Minister, for those insightful comments. And I think we all take well your counsel for humility. I think that's also true. This is extraordinarily complex, as you indicated. I think your experience in 2008 and 9 serves us well with your insights today, as well as your background as an economist. Our next speaker from South Korea is the Honorable Sang Hyun-yoon. He is a National Assembly member. I think this is his 4th term of service. He was recently elected, most recently on April 15th, just a short
right
ago. So please have the floor, Honorable Yoon.
Okay. Thank you very much for your invitation. Well, Honorable Chairman Walsh and other distinguished panelists and audiences, well, I'm Sang Hyun-yoon, Chairman of Foreign Affairs and Unification Committee of South Korea's National Assembly. And it's been 4 months since the initial confirmed case of the novel coronavirus was reported in Wuhan, Hubei province, China, last December. It took only 4 months for COVID-19 to hurt a whopping number of people and the economy. As of this 22nd, the number of confirmed coronavirus cases has reached 2.52 million, and the global coronavirus death toll stands at more than 170,000 people. It is unfortunate that there is no improvement in this situation, where the daily new cases are reaching almost 100,000. What's worse is COVID-19 is posing great threats to the global economy. IMF predicted that the pandemic of coronavirus will cause $9 trillion of economic losses globally. It also lowered the global growth by 6.3 percentage points to a negative 3 percentage points, hinting the worst economic recession since the Great Depression. The first wave of the new coronavirus struck South Korea. South Korea saw its first confirmed COVID-19 case at the end of this January, and the number of infections has much more rapidly increased than other countries that banned the entry of the Chinese, such as the United States, Japan, and Australia. It well explained that South Korea had once ranked the second in terms of total number of confirmed cases following China. Mercifully, South Korea has learned from the 2015 outbreak of MERS, Middle Eastern Respiratory Syndrome, reorganized its disease control system and geared up against a new virus. The primary healthcare providers treated and took a great care of patients, faithfully following a well-organized guideline. Not only that, our exemplary citizens carried out strict social distancing measures, such as wearing a facial mask. The control towers for disinfection could work more efficiently as unified, centering on South Korea's Korea Centers for Disease Control and Prevention. The system tracking and controlling the overseas entrance built during the MERS outbreak have been working well. In collaboration with small and medium-sized enterprises in South Korea's major companies, including Samsung Electronics, could dramatically increase the production of facial masks. Above all, our medical staff, who devoted themselves to combat the virus at the forefront, deserve all the credit. Thanks to their noble efforts, South Korea shows clear signs of slowdown in new virus cases, reporting a daily increase of around 10 for the 5th day in a row. However, the biggest concerns deal with other countries still waging war against COVID-19. In particular, some marginalized countries are in a grave situation that requires more active support from the international society. North Korea, Iran, Venezuela, Cuba, and Syria could be included, as they are in the blind spot between disinfection and economic sanctions. We need to provide more targeted support and humanitarian aid for those in desperate need. The United States announced that humanitarian trade with these countries are temporarily excluded from the sanctions list due to the worldwide spread of the pandemic. South Korea, at an urgent request of Iran, opened a presentation meeting regarding humanitarian trade and introduced 27 Korean companies related to this industry, including test kits and manufacturers. North Korea is another exception. We need to consider providing North Korea with humanitarian medical support, as its poor medical conditions make its people more vulnerable to the new coronavirus. Humanitarian aid is necessary for them to keep the virus from spreading. It's the time to build an inter-Korean cooperative system for the prevention of the spread of the pandemic and consider dispatching a medical team to the vulnerable communities in North Korea. The world is now fighting a common enemy, COVID-19. However, not all countries have necessary conditions or capacity to combat this novel virus. In order to minimize the damages predicted to surpass the scale of the Great Depression, the entire world needs to exert a concerted effort to eradicate the new coronavirus. Some advanced countries can slow down the spread of COVID-19. However, a reinfection could be a question of time if this virus lingers on in poor countries. This is why all countries in the world should cooperate with each other, regardless of religion, politics, and nationality, to completely eradicate COVID-19. South Korea will spare no effort to share our medical technologies and know-how in disinfection with global society as an exemplary member of the world, which went through the virus beforehand. If the world gathers all the strength, succeeds in preventing the spread, expedite the development of vaccine and eradicate COVID-19 earlier, I'm sure that a pan-global prevention system can be made to effectively to deal with another pandemic issue in the future. We can lay a foundation for the post-corona era to deal with a bunch of future issues in the areas of economy, industry, education, health, and security with a concerted effort. COVID-19 is a calamity, but this is also a turning point toward a new era at the same time. All countries will get an experience wisdom accumulated for centuries and finally overcome this crisis. I sincerely hope that the world will open a new renaissance where innovations make the leap in the better future. Thank you.
Well, thank you very much.
Dr. Walsh, before we move to the next speaker, I'd like to ask for your understanding. I'm afraid that I have to leave this conference due to unavoidable circumstances, and thank you for your understanding once again for hosting a meaningful video conference at this critical juncture. Okay.
We're delighted that you joined us, Honorable Yoon, and for your presentation. We're grateful. We understand it's midnight there in Korea, and
yeah, it's midnight.
Work to do even in the wee hours of the morning. Thank you very much.
See you next time, sir. Okay.
See you next time. I look forward to that.
Okay, thank you.
Thank you. Final statement will come from Dr. Intisar Azzuz. She's advisor to the President of Libya for Women's with us for the World Summit 2020. And I'd like to give the floor to Dr. Azzuz.
Thank you, and good morning or good afternoon, wherever the distinguished participants are. I am honored to be invited and have the opportunity to speak to you. Today is a special day for over 1 billion Muslims around the world, as it is the first day of the holy month of Ramadan, a month of fasting. So Ramadan Kareem to all of them. Yet this Ramadan is different from many others in our lifetime. In my country, Libya, before I say that, I could see that the other speakers are of a more advanced countries, and then I'll have a comment on that later. In my country, Libya, like all countries around the world, there is concern about COVID-19, a country of 6 billion people. It has gone through a lot of turmoil over the past 9 years since the former regime was overthrown. Turmoil that has broken into fights, civil war, death and destruction, and hundreds of thousands of displaced people, decaying infrastructure and poorly equipped medical system. So when this pandemic started, I could share that the whole people were so extremely terrified to see that even Europe and the United States and other countries and Asia and so on, who are very well advanced in medicine and in every way actually. Yet, despite all these incidents that Libya faced, the virus infections remain very low compared to even neighboring countries. To date, we have less than 70 cases have been registered in Libya. Not completely clear how did this happen. Since the outbreak of COVID-19, the government took a bold step to close Libyan borders to all travel. Airports were shut down and no one was allowed in with very few exceptions for most land borders. We still have the southern border, it's kind of hard to control. This situation is 6 weeks old and continues today. This action, of course, has, I'm sorry, my throat because I couldn't drink water, it's okay. The problem, we have more than we have 2 governments in Libya. So each government is doing their best in providing for the people. We have a problem of how the people are taking this or participating in it. Curfew has been forced in most of Libya, but curfew goes certain hours. Mainly now it's from 6 in the evening to 6 in the morning. So during the day, people are free to go out and shop and so on. Most of the people are not really applying what it needs, what the situation needs to keep healthy or safe, even though information is provided. Hospitals are prepared as much as we can in Libya. There is lack of equipment, there is lack of medication. Lately, we had some arrived from as support from other countries. The action, of course, has left many Libyans who were traveling abroad, left them stranded. My husband and I are among them, since we happened to be in Istanbul at the time. So within days of the start of the pandemic, arrangements were made by Libyan embassies and consulates in several countries to house those stranded people, mostly in hotels. In Turkey, for example, 11 hotels were used to house some 2,000 Libyans who were in Turkey for business travel or medical treatment. Since the past week and continuing, most have been examined for COVID-19 infections, and those who were those found negative are housed in airport hotels for 14 days before arrangements are made to bring back to Libya in charter flights. Also, in the eastern part of Libya, efforts are in place to fully prepare a university building at the city of Brega, which is in the eastern part, to house those coming from Egypt and Jordan for the 2 weeks of quarantine following arrival to Libyan-Egyptian borders. Like you can see, we have several problems. As we have less infections within, we are trying to keep infections from coming from outside. So whether like in Turkey, they house them in hotels, or whether like in the eastern part, they're gonna take them from the borders of Libyan, Egyptian, and house them in universities. We had shipments arrive to Libya with masks, and people are making their own, what do you call it? Disinfectants. But, you know, it is still waiting to see where we're going to this. Up to now, we were blessed. We don't have a major disaster in the country, but I don't know what to expect, especially seeing what happened to Italy and to Spain and to Germany and to the United States and what have you. The fear is that the worst is coming. I wanted to add that my feeling, my personal feeling, that we owe it to this small virus, that for the first time in history, humanity has united rich and poor, governor and governed, politicians and people, families got to know each other, parents to know their children, pushed to reevaluate priorities in our lives, showed us how weak we are and how fake our powers are. We all hope and pray that a cure and vaccines are found quickly for this unprecedented epidemic. But we also hope that the lessons we learn, that we are one human family, that we should spend more on people's needs and welfare and less on weapons of war and destruction, more on opportunities for all rather than accumulation of extreme wealth for the very few, that we should value more those who serve humanity, such as doctors, nurses, social workers, teachers, community workers, rather than celebrities and so on. We hope that these lessons we are learning now are not soon to be forgotten. Thank you for your time and thank you for listening.
Thank you very much. Thank you very much indeed, Dr. Azuz. And thank you for your encouraging words there to conclude that in some ways this virus has taught us lessons about ourselves and how to love one another better. I want to just ask one follow-up question to our panelists, really about the role of multilateral institutions. We could ask, what is the United Nations doing? We hear about the World Health Organization. There's also the regional intergovernmental organizations. In Africa, President Jonathan, the African Union. We have the European Commission. I heard recently that the President of the European Commission is taking aggressive action. They've come up with a relief plan. They apologized for somewhat delayed response in the case of Italy and Spain. And there, of course, the Arab League and the Organization of Islamic Cooperation. I'd like to invite any panelists to say a little bit about these levels of governance. As President Jonathan mentioned, we have the local, the provincial, the national, and what role are these multilateral institutions taking, or could they or should they play? So I open that up now. I think each panelist can speak. I ask you to keep your remarks to approximately 1 minute or so, because we have a long queue of questions coming from an audience of more than 500 people that have questions. So we hope to hear from as many as possible. But if any of you would care to reflect a little bit on that point about the role of multilateral institutions.
Yes, I could talk on that. I could address that. Is that okay?
Sure.
Okay, we are working in Libya on the base of municipalities. So each municipality is trying to take care of its surrounding. Our major problem is we have thousands of displaced people, and that adds to the problem, like in Tripoli. There is war and there is the epidemic. Schools are full of the displaced people. Hotels are full of the displaced people. So this is one of the problems, and we tried to work before with the UN and with other organizations to provide at least temporary housing, and we were not successful. We didn't receive any help in that sense. But also we are working, like I am a member of the Libyan Women for Peace network. We are working with the UN office in Libya. We are providing information, knowledge, getting equipments and things dispersed. Civil society is really having a major role in helping with this one. That's to sum it up fast.
How about President Jonathan, about the role of the African Union, as you see it, either that it is playing or perhaps that it could play?
Thank you so much, Dr. Amal. The African Union and for me in West Africa, the Economic Community of West African States have their own initiative. The African Union have the African Center for Disease Control and Prevention. I think that body was set up following the 2014 Ebola virus incident that devastated a number of African countries. So they set up that body. But I believe because of limited resources, it may not be as effective as we would expect. But they are emphasizing on getting test kits across the African continent. Because just like as I even said in my introductory remarks, that locking down of cities, closing the borders without aggressive testing will not solve much of our problems. So they have that initiative. The Economic Community of West African States recently appointed the president of Nigeria, President Mohamed Buhari, to even lead the ECOWAS initiative in terms of confronting the COVID-19 pandemic. So they are doing, but I think they have basic limitations in terms of getting resources and equipment across to the countries within the continent. Thank you.
Thank you. Prime Minister Harper, you know, one potential outcome we're seeing, you mentioned there's some tension between the US and Canada about the personal protective equipment. And, you know, some argue that we may be moving toward greater nationalism, emphasis on self-sufficiency of nations, perhaps a diminishing of trust among nations. Do you see some crisis for multilateralism going forward?
I do think that's a possibility. You know, I think, Dr. Walsh, I think governments, when this all settles out, when it's, you know, when we're through the crises, people will sit back and they'll judge governments based on their performance. And I think certainly in our part of the world, in the advanced part of the world, people will see that it was national or even subnational governments that were generally the ones responding. I don't think they'll see that at the international level. I mean, look, I think we have to be frank about the World Health Organization, and I'm not debating that it does some good work, but it was responsible at the outset of this crisis for spreading misinformation about the virus from China. That's just a fact, and it will be judged by that. So I think the lesson is this. I think multilateral institutions are actually quite constrained in what they can do unless they have national governments working together and cooperating. So rather than try and pretend that multilateral institutions can do things on their own, I think what's important is that we understand people look to their national governments so that at the national level where they actually have democratic input, and we encourage those national governments to work cooperatively. I think that's the solution to the problem. I think multilateral or international institutions working on their own are often quite ineffective. So I wouldn't necessarily look to them for the solution.
Thank you, Mr. Prime Minister. At this juncture, I'd like to turn this over to Dr. Selig. He has been going through the chats, and there's a long stream of chats. I would say that it's filled with plaudits for our speakers, and we'll share these with you. But Dr. Selig, could you, we have about 12 minutes left, perhaps some of the questions from the audience.
Yes, of course. Thank you, Dr. Walsh, and thank you, panelists. The first question would be directed to Dr. Azuz. This is from Mr. Roger Weatherall. In what ways do you see that the world is going to be substantially changed going forward? What good may come from this virus?
This depends if we, each person, be responsible for their act. Now we know that there are no strong countries, no advanced countries in face of a small virus. Everybody is suffering. So if we take this as a lesson, I think that should change our attitude all to each other and to humanity, and face on the improving human life and the well-being of humans instead of fighting and occupying and attacking and all of these. So I'm relying on the good of the human being, the good nature of a human being. I might be optimistic, but that's what I'm hoping for.
Thank you. Bill?
Yes, thank you. Next is the question for President Jonathan from Martins Ogbu. He says that since you were the head of state in Nigeria during the Ebola epidemic, judging from your experience in containing the virus and limiting its spread, how can we effectively manage information dissemination as we struggle through this pandemic? This is anchored on the very dangerous falsehoods and rumors surrounding the origin, cause, and management of the virus, period. Mr. President.
Thank you so much for that question. Yes, in 2014, when the Ebola crisis hit Africa, especially Sierra Leone, Liberia, Guinea, and of course Nigeria, I was the then president. We were a bit lucky because we got the information early enough and we intervened almost immediately. So we were able to reference or block and track the primary, secondary, and tertiary contacts of the index case, which was the Liberian, one Sawyer that came into Lagos. So we had this incident only in Lagos, in Port Harcourt, and Enugu. But what I did then was, I was actually in the United States of America when the incident happened. And when I got that information on Thursday, I left the US that Thursday night, and I arrived at Nigeria Friday morning. And from the airport, I moved straight to my office, and I called a meeting of the key stakeholders, the health minister and his team, the finance minister, the general water resources minister, the key actors in this. And we held a meeting, and of course, that very day, I declared state of emergency and giving directives as to what people should do and what people should not do in terms of crowding, in terms of managing people that are sick, in terms of managing corpses if people die, and so on. So we give strong instruction, don't move any sick person or somebody who is dead from one point to the other except with medical clearance. And in the next 2 days, I had a meeting with all the state governors and their various commissioners of health. So we interacted and we all agreed to approach it from a common platform. So the federal government and the states, we are working together in concert and in the same direction. And our messaging was very clear because we made issues very clear to the people. And because the messaging was very clear, I think there's maximum cooperation, even in terms of religious leaders, people who go to churches, who go to the mosque, to agree with us. So it was easier for us. And it did not spread outside these three cities, Lagos, Port Harcourt, and Enugu. So there was no reason for lockdown. No city was locked down, and we did not also limit the movement of citizens because they didn't get to that level. But within a period of time, about 2 weeks or so, we were able to get out of it, even though the World Health Organization gave us another 3 weeks or 4 weeks before they announced that Nigeria was Ebola free. But the quick response solved our problem. If we have missed that meeting, like came in from Abuja and held with the people that Friday, things would have gotten out of hand because it would have been difficult for us to trace all the contacts. But because we met almost immediately, it was easy for us to trace all the primary, secondary, tertiary contacts of the index case, and we're able to quarantine those people within that period and manage the incident. That helped us very well.
Thank you, Mr. President. Bill?
This next question is from Mr. Harper, from Mr. Mark Brand. He asks, until now, it seems that governmental measures worldwide in response to the pandemic have been largely informed by the expertise of virologists, epidemiologists, and those in related fields, rather than by reliance on other disciplines such as economics. Should input from other disciplines such as economics and finance have been factored in much earlier so as to avoid the possibility that the cure will prove to be worse than the disease?
So it's a good question. I go, Dr. Selig, once again, back to my earlier comments, which is, let's be a bit cautious about judging governments harshly here. I think that all governments have, to some degree, been trying to address both a health crisis and an economic crisis. You know, look, I would say this, as a government leader in a democracy, it is very important that you listen to the experts, but there are competing expertises here, and governments ultimately are responsible for their final decisions. I do think there has been, in some cases, too much emphasis on the pandemic at the expense of the economy, and too much deference to health authorities, but that's a really tough call to make. What I would say is this, and I think this is fairly clear. Where health systems have been overwhelmed, we know that governments, you know, probably should have put more emphasis on the health response. But there are many parts of the world, including parts of my country, where health systems are, frankly, the COVID wards are almost empty. So, you know, I think you could say in those cases, governments maybe have gone too far on their economic measures, but it's a tough balancing act. And you can go from nobody in a COVID ward to the ward being overrun very, very quickly. What we do know for sure, I think, is that, as I said earlier, the size of the coming recession is, I think, seriously underestimated. You know, just take energy markets. Global oil use is down somewhere in the 20 to 30% range. You know, and that's a proxy for economic activity probably being down at least that much. Those are enormous numbers. The implications of that on social order and political stability around the world are immense. So, look, I think it's unfair to say governments have not been listening to both or prioritizing both. I just think it's a difficult balancing act, and no one's ever had to do this before.
Thank you, Mr. Prime Minister. I think we have time for one more, Dr. Selig.
Very good. This is for Dr. Azuz. She says, this is from Edith Kalanzi. How do you think that the developing countries could balance lockdown and daily survival for the poor? Couldn't civil unrest ensure if lockdown took too long?
Most likely. In some of the countries, most likely. I will give you an example. In Libya, for example, salaries were not paid for a few months. So suddenly people are hit with this COVID-19 disaster. And the government tried to lock down. And then money came into the banks and they announced, go and get your salaries. So you could imagine the crowds and the disaster that happens. I don't know. I don't know what will happen. It's hard to predict, but people are already suffering. Poverty is showing lack of, even food prices are going up and extremely up, especially for the month of Ramadan. So things could happen. It depends from one country to the other, but that's part of the change that we expect in the future. Hopefully it will be better if we handle it better, but I agree with you. There might be unrest in some of the countries.
Thank you, Dr. Azuz. I'd like to take more questions from the audience, but we're already nearing our concluding moment. I want to give each panelist a chance to offer any final thoughts. I'll suggest something you could try to address, and it's kind of where do we go from here? What is the world going to look like? Some are saying we're going to have a radically new kind of world. We're all learning about Zoom and spending hours and hours each day in webinars and that, and people are taking classes at home rather than at their institutions. There's talk of food insecurity in the future, et cetera, from a recent UN report. Where are we headed? So maybe I'll ask President Jonathan, you can address that, or you can give whatever else you'd like to say as a concluding couple of words, 2 minutes or so each.
Okay, thank you, Dr. Walsh. For my concluding remarks, let me use this unique opportunity to appreciate the Universal Peace Federation again under the leadership your humble self. Then let me also use this opportunity to sympathize with those who have lost loved ones to COVID-19 pandemic across the globe. The number of people have died is quite a number. The number of countries, especially the African countries, will have a lot of widows, a lot of orphans. That managing them will be a problem. Going to school, health challenges will be there. But one clear thing is that we'll use all this opportunity to also plead with the developed nations, because though they are also impacted, but I know they will recover faster than the developing countries and the global financial institutions, to look at the issues of how do we look at the world economy after COVID-19. And I'm quite pleased with His Excellency, my Prime Minister of Canada. We also interacted in South Korea, so I'm quite pleased with his position in an economist. But I believe and I request that the developed nations and the global financial institutions to look at issues of debt relief and debt standstill. Most countries cannot pay their debts within the next 4 to 5 years. So we should give a moratorium period, even if they will not forgive the debts completely. It will be better that debts are forgiven to these countries so that they will build up their economies fast. Because if these countries don't build up their economies fast, it will affect also the developed countries. Nobody to buy the industrial produce that they will manufacture. So the whole world economy should be properly looked into by the World Bank, IMF, and other institutions so that proper advice is given to developed countries and the developing countries. For the developing countries like Nigeria, this is a challenge, but it's also an opportunity for us to look into how can we produce some of the simple equipment used for our health institutions, especially the personal protective equipment. Some of them may not be too sophisticated in terms of production. We should be able to produce this in-house. And I believe our business people too will key into this and begin to look forward that we should make the best out of this very ugly situation that the world is facing. Thank you all.
Thank you, Mr. President. Prime Minister Harper.
Yes, thanks. Once again, thanks for having me on this. I really appreciate it. Let me end on the health side with an optimistic note, which is that at least in advanced countries, I think we're more worried about developing countries, as our other panelists, President Jonathan and Dr. Azuz have said. But in advanced countries, as bad as this has been, if you look at the overall statistics, particularly on mortality, they are significantly below what some had anticipated at the outset of the crisis. So I think we have some reason for optimism there. We're also developing considerable expertise on response to pandemic, which I think will be helpful in the future. And I recently just hosted a webcast through the International Democrat Union, the World Alliance of Global Alliance of Conservative Parties that I chair, where we discussed a wide range of treatments, vaccines, other pharmaceutical measures that are coming online reasonably quickly. So as bad as this all is, I do see much light at the end of the tunnel. As I said, I think the challenge that's going to be with us is on the economy. And I really think our governments, in particular our Western governments, are going to be faced with two things they need to do, and they're not easy to balance. One is protecting democratic governance, protecting national security, particularly around supply chains, and quite frankly, dealing with some of the problems, both economic and health-wise, that the government of China presents to all of us. Doing all those things and yet keeping markets open and keeping getting a higher degree of international cooperation. I think that's the challenge ahead of us.
Well, thank you very much indeed. And for our final closing word, Dr. Azuz.
Yes, well, I would like to quote the Washington Post reported this morning the following. Africa's reported number of coronavirus cases soared by more than 40% in the last week. Shocking concerns that the continent could become the epicenter of the pandemic at a time when hunger is rising and doctors fear a resurgence of malaria deaths. The virus threatens to kill more than 300,000 people in Africa, according to a United Nations estimate, and plunge tens of millions more into poverty. This puts us to face reality. You know, it's good to hope, it's good to be optimistic, but there are realities that we need to face. We need to figure out how are we going to deal with this. My country is in Africa. We don't have many cases, but if Africa is going to plunge into that, it's coming everywhere. We're surrounded by countries that has thousands of cases. So I can't be optimistic. I'm worried about the future. We'll see. God will help us, inshallah.
Thank you, Dr. Azuz, and thank you to all these excellent panelists. You created a very informative, stimulating, and encouraging set of presentations, and we had approximately 500 listening in. The chat level was high, and we very much appreciate your being with us this morning for the program. Is Jeannie Kagawa on, or shall I
Yes,
just...
I'm back here. I'm back
Okay.
again. All I have to say is thank you to our excellent speakers and to all of you for joining our Peace Talks webinars. And please note that, oh, I'm sorry. Please note that the next Peace Talks webinar will convene on May 1st. And we'll focus on the work of the International Association of Parliamentarians for Peace. And the theme of that particular webinar will be the role of parliamentarians in meeting the challenge of the pandemics. We hope to see you then, and thank you very much. Thank you.
Thank you.
Thank you